social work and health lunchtime session, and thank you for giving up your lunchtime to be here. My name's Denise Monks. I'm a professional officer with BASWA and I support the social work and health group. We have Angie Button here with us today, who's the chair of that group. And we have Tommy, who has kindly offered to deliver today's session. So I'm going to hand over to Tommy now because he's going to introduce himself, describe a little bit about his role, and then get on to our topic. We will have time at the end for discussions and some just general networking, if you like. Please do use the chat to introduce yourself to the rest of the attendees. And it's over to you, Tommy. Thank you.
Thanks, Denise. Welcome, everybody. Really lovely to talk to you and talk a little bit about what I'm doing, some of the things that I'm working on and some of the things that my program that I work on is working on. So I'm just going to share my screen and then I'll do a bit of an intro. So the customary question, can you see my screen?
Yes. We can, but it's in full screen mode. Yeah, perfect, Tommy. Yeah. Okay. We've got it.
So I've figured out a way of being able to see you and present at the same time using two screens. So welcome, everybody. Yes, thanks, Denise. My name's Tommy. I'm the lead social worker for a programme called the Digitising Social Care Programme, which runs across the Department for Health and Social Care and NHS England. It is funded by the Department for Health and Social Care, and my role is to provide subject matter expertise and engagement with the sector on all things to do with digital and technology. As a very brief background, I've been a social worker for about 15 years. I've worked in children's social care, youth offending teams, and then the majority of my career has been in adult social care. So I've worked in hospital discharge, community, local authority social work. I was a best interest assessor, led a safeguarding team. And after working in those areas, I've subsequently gone into work into more policy government spaces. So I spent a year working at what was NHS Digital, advising them on social care tech and data, and I then spent 3 years working for a not-for-profit care provider representative body. So I got to see the world of the care provider as much as the local authority social worker, as well as the NHS, and now working for government across NHS and social care in around digitisation. So the reason that I'm in this game is not because I'm a techie, it's not because I do coding on a weekend or I'm a gamer or anything like that. I just have had multitudes of experience as a social worker where technology has prevented or curtailed a person's experience, made it worse than better, and has made my work world worse than better. But I do believe that if we think about technology in the best way, which is the person-centered way, if we get it right, it can be a remarkable, powerful tool for people who draw on care and support. But that doesn't happen by chance. That needs empowered, knowledgeable people to steer the conversation, linking it to our topic for today. So what I'm going to do is spend 25 minutes, half an hour, just going through some of my thoughts, reflections, and what we're doing as a programme. Then I'm really keen to hear your reflections, what's going on for you, and an open invite at the end to come and join various communities of practice that I am either involved in or run, because the more social workers we have in this space, the better. And this is certainly not something that needs to be led by me at all. And I have more questions than I do answers. So I'm very keen to hear what you have to say on the topic. So Digitising Social Care, very quickly, the programme is across Department for Health and Social Care and NHS England. We commission lots of different work through our providers at the bottom. So we commission Local Government Association and ADAS to do some work for us. We also commission Skills for Care to do a lot of work for us, as well as Digital Care Hub, which is the digital wing of the care provider trade bodies. And our commitment is to try and push and drive digital transformation across social care in England, whether that's a council or whether that's a regulated CQC provider of care. So this is adult social care, not children's social care, but my experience, and I think the themes today are applicable whether you're working in children's transition or adults at any point, really. So who's leading the conversation on social care and technology? So I wanted to just show you a snapshot of some pictures here. It's no surprise that technology is front and center to all of our lives personally. And therefore it's going to be front and center to so many of the lives of the people we support. Technology is going to shape every aspect of our lives. And we know that digital innovation is occurring across children's, adults, education, housing, probation, police, health, everything. So where do we stand as social workers on this? How confident do we feel around engaging in the conversation? And where would we go if we were confident? And where would we go if we weren't? And these are some of the headline snapshots that if you do a very quick search on Google, you can find these are very recent examples that unregulated artificial intelligence being used for care plans. Very interesting, very useful, but not regulated. So what's our view as social workers on that? And will civil servants be replaced by chatbots? I doubt it, but at least, it's a topic that's hit the news regardless. So if we are not leading the conversation around these topics, then who is? Because somebody will. And what is our role as social workers in that? So is digital relevant to social work? Is it something that we should be thinking about? Is it part of our sustainable drive as social workers? So my first question is, does anybody know who this is? You can add this to your pub quiz knowledge. So this is a lady called Mary Richmond, who in 1911 was talking about social workers using technology. In 1911, yonks ago. So social workers have been talking around technology and about technology for a long time. So it is remiss of us to separate the two for so many reasons, but we know that people have been talking about it for a long time. And she was advocating people using the telephone, would you believe, as part of a practice tool to engage with people, which today you would think, well, that's obvious. But I guess if you translate the theory or the theme that I'm talking about then to now, is what I'm talking about outlandish or obvious? And compared to what Mary was saying all those years ago. So when you think about social work and technology, is it sustainable? Do we carry on the way we are? Do we need to think slightly differently? And these are a few quotes for some academics who talk about the idea of, in a digital age, what's the ethical and risk element of doing things or not doing things, being active or inactive as social workers? Is it our job or is it someone else's job? Whose job is it? And in 2019, an academic called Amanda Taylor Beswick explained that she suggested that actually there has been since the 1970s an exponential growth in how technology is used in our society to reshape it, and it's going to be a dynamic force going forward. So if social workers are intrinsically part of society to improve the lives of people and empower and advocate for people who may not have a voice, if we are not part of the conversation around how technology is used, are we missing a trick? And what is the risk of us not being empowered as social workers? So is it actually rooted in definition? So if you look at the global definition, which I'm sure you're all familiar with, where does social work, technology, and values sit in that conversation when we think about technology? We know that very vulnerable people who are in need, who have care needs, will need to use technology. So what, as social workers, when we enter into someone's situation and their story, how can we empower and encourage and improve their situation and their quality of life experience if technology is intrinsically linked to their care? Think about technology as actually a vehicle to increase the cohesion of social ideologies, social justice, and documenting life and improving well-being. But again, as I said in my intro, that won't happen by chance. That happens through social workers who are aware and au fait with the topics and knowing how to steer or the questions to ask or going to other people if they don't know that. How confident do we feel in those scenarios around values, ethics, questions to hold, and holding digital to account? So I'm not suggesting that social work and technology, we should rush ahead carte blanche. I think we hold a unique space as social workers in being digitally critical. Technology is there. It will always be there from now on, but it's the role it plays, and is that best for the people we support, and is that best for us and how we use it in our profession. So is it relevant to us? Digital professionalism. These are examples that are readily available online, all of social workers, horrific examples of social workers misusing technology in all kinds of ways, with profound damage to the people that they are supporting, the organisations that employed them, and profound damage to us as social workers and our reputability. So we can't be naive to the fact that it's there and it's not our gig boss, it's someone else's. We have to play a central role in that. So I wanted to just give you a few examples as opposed to aloof concepts that might be nice to listen to but have no practical reality in our work. We know that children are using dating apps all the time online. Snapchat as an example, sharing data about themselves with people that they might not know at the other end, and the myriad of safeguard cases that occur as a result of that around cohesion and so on and so forth. We know that there is going to be an analog to digital switchover of technology. So all technology call center alarms will be moving to digital. And there are so many assistive technology systems out there that currently use analog. When they're switched over, are we prepared for that switchover? And what damage occurs if that tech is no longer in use, but the people who need it still need the care? How confident are we or aware of that? What about pendant alarms that are administered carte blanche to people who need telecare services, but then they find that their dexterity is so poor that they're not even able to press the button? How person-centered is that? What about the 25-year-old man with autism who really struggles with loud noises and strip lighting, who needs to go to A&E because he's had an accident in his educational centre? How can we articulate that strip lighting, loud noises, and effectively the front door of A&E is going to cause massive problems for the hospital and that person and triggering their behaviour? How do we share that information? The answer is seldom can we, other than through telephone. And the risk of that information not being shared and that young person being massively triggered by loud, strip-lighted noises in a very acute environment, causing all kinds of problems for themselves and the health service. How person-centered is that? What about the fact that we know that domestic abuse perpetrators use technology to track their victims? And if we as social workers step into someone's space around safeguarding and care, how aware are we that that is something that perpetrators are using? And how can we be proactive and advanced in that thinking? We also know that there are a number of local authorities who use artificial intelligence around their care assessments. A number of local authorities use Copilot, which is run through Microsoft, to help record care assessments. We also know that there are other softwares out there that I have seen and demoed myself that are really interesting and person-centered, but technology and AI is being used to help social workers with workload, recording and mapping care notes, and then creating care plan action notes as a result using technology. How confident are we as social workers about critiquing that, saying, yes, it's good, but, or are we floundering at the concept and don't really know where to stand? So I wanted to give you a real life example, which is really sobering, but I think it's really important to talk about it. So this is in the public domain. This is readily available on the internet if you wished to find it. This is the serious case prevention of future death report for a gentleman called Reginald Cawthorey, who was in his 80s, who was known to services and was described as very frail with limited mobility. He lived alone. He had telecare installed. Fire services knew him. Complex case social worker was allocated. Pendant alarm in place, known to voluntary services, known to community services. He was a heavy smoker and a heavy drinker, and he died suffering wide-ranging burns. So the majority of his harm was occurred in his bed, and he was drastically moved to hospital, but sadly passed away. So when you look at the actual case review, there was no review of telecare services. So in other words, he had a telecare alarm. Social services knew what his risks were. The fire service knew what his risks were. The ambulance service knew what his risks were. His housing association knew what the risks were. But nobody knew to connect his telecare services to emergency services. So when he rang telecare and pressed the button, telecare, it took 5 minutes for telecare to then contact the emergency services for emergency services to come. Whereas if his telecare had been connected to emergency services directly, which is more than plausible, that may have saved his life. His smoke alarm wasn't connected to emergency services either, given that we all know the risk. So the lack of connectedness, the lack of practitioners' awareness that technology can do all kinds of different things was in part influential to this man's passing away. What a tragic case, and actually a very simple potential solution, but nobody knew. But if people did know, would the scenario have been different? I guess the answer would have been yes. So when we think about the future, when we think about what does social work look like, given all of the evidence that I've presented, there's lots to think about. We know that it's a dynamic force for future generations. If you have children, you will know how quickly adept they become at using technology in their personal lives, in their school or academic lives, and equally in our own lives. If you think about the invention of the smartphone in 2006, 2008 to what it is now, imagine what is going to happen in 10 years' time and what that will look like. So, and I wanted to show you a picture on the right-hand side here that this is a recent post, the 10th of May, in fact, in BBC News, that this is a broader point than just technology, is that those two ladies who were arrested for Just Stop Oil were not zealous teenagers who had a sort of black and white view of life. These are older people who are saying enough is enough. This is not acceptable. And the point I'm trying to make here is that technology is part of a broader topic, that actually people who need social workers, people who draw on care and support in the future are going to expect, I would suggest, that the care that they receive is greener, that we are more aware of the green agenda, and by extension to the topic of conversation today, that we are more aware of the green technology agenda. And equally, if I think about my own parents who are independent in their 70s, they use an electric car, they have Wi-Fi throughout their house, they have Spotify, they have Alexa connected to various parts of the house, Sky TV, Netflix, Disney, and so on and so forth, just like most of us do. So in 10 years' time, they are likely to want care and support in different guises, potentially, depending on what happens. I doubt that they're going to say, I don't want that technology anymore. They are going to see technology as part of their everyday life and quality of life. And if we think about people who need care, and the second bullet point I wanted to make here is that I think that people are going to see technology, and if I use the smartphone as an example, I think people are going to use and think about devices as inextricably linked to their experience of care. And if, as social workers, and we look back at the global definition of social work value, if we are charged with protecting people, advocating for people, and so many other really important, valuable aspects of what it means to be a social worker for people, if people are intrinsically connecting a device and experiences to their care, we need to be up to date with that. We need to be au fait with that, because if we don't, and we don't know, then we are surrendering our influence as unique positions in this society as social workers, because we let other people lead the conversation. I would suggest that data will increasingly become more and more and more important and pertinent to people. And I would suggest that if you take banking as an example, gone are the days where you would be unable to share money via a sort code and account number anymore. For example, let's say you go out for dinner and you want to share the meal and you say, oh, can you just give me your bank details and I'll share that money with you. And you put that person's bank details into your phone, or you go to your bank or whatever, and your bank says, oh, I'm sorry, we don't share information with that bank. You'd think, what? That's nonsense. Of course you do. It's money. We should be able to share it. But when it comes to information about us, our story, what we like, what we don't like, the care we need, the care we don't need, how we like it, how we don't, we seem unable to use technology to share our own story. We all know from going to any health interactions ourselves with any sort of interaction with social services or the health service or community services, the amount of times you have to repeat the information about you in order to ascertain what you need or to articulate to the people who are supporting you what care you need. Is that the future? I would suggest no. I would suggest that people are going to more and more demand that this is information, my information. The onus is on you to work out how to share it. So I think more and more people are going to be empowered around how they want their data to be used and the vehicle that technology is to use that. So as social workers, how do we play a part in that? And what do we need to do? And therefore, what is the role of social workers? Maybe in years to come, we will have social work technologist roles. Forgive the phrasing because I don't like the phrasing, but the essence that social workers who are person-centered and hold technology to account, embedded into different organizations. I'd like to see it happen, but it's a conversation we need to continue to have. So did you know, to continue the pub quiz theme, your second pub quiz knowledge, these are the only standards as part of your social work registration, whether you're renewing it in children's social care or adult social care, that relate to technology. So one is around behaviour, second one, and the digital professionalism slide that I showed earlier is in stark contrast to that. There is standard 5.6, which is around technology, social media, and other forms of communication unlawfully, unethically, that brings the profession into disrepute. And the first one is around maintaining skills in the way that you practice. So those are all very good, they're very important, but I think there's one missing there, which is how social workers think about supporting people who are using technology and the role of social work and social work values in that. So those are the only ones that we have to adhere to, and I wonder how confident you would feel about evidencing any one of those 3 points. So as a programme, what have we done? Because I've talked for 15 minutes there around, or near on 15 minutes around the idea of where I see the gaps, where I see that technology is moving at a rapid rate, and where do we sit as social workers? So what have we done? You know, what role do we play as the national programme in that? So in 2021, we commissioned via Ipsos Mori and Skills for Care a social care review of the digital landscape across regulated CQC care providers and local authority social workers and occupational therapists. And there were lots of themes that came out of that, as you can imagine, but the one that comes to mind for me is that the thing that came up time and time again was practitioners, staff, professionals not really knowing what was the suitable technology, what was available, and where to go as a repository of advice and guidance. Nobody was arguing that technology wasn't important, but most people were saying, I just don't know where to go to find out anything about it. I'm not empowered. I want to be, but where do I go? Compared to our health counterparts in the NHS, which has much more of a coherent repository of guidance and regulated medical apps. Of course, social care technology is not regulated in the same way, which is another risk in and of itself. We followed that up last year with a skills review with social workers and occupational therapists last summer. And that report recognised that for both social workers and OTs who work in local authorities, that was the demographic we spoke to, more targeted and training and learning opportunities were what were required, whether embedded into supervision, embedded into CPD, or embedded into renewal. Again, nobody argued that social work and technology were not things that should be interconnected, but just didn't quite know where to go. So we follow that up finally with, if you work in a local authority, the national summary report we did a welfare check, or we asked local government association to do a welfare check with all social workers and OTs who work in local authorities. We had 15,000 respondents, which is the biggest respondents to any digital survey we've ever had. It's the most data we ever have on social workers who are talking about technology. And here are the headline summaries. Social workers tend to say they feel quite confident with technology, but they tend to feel more confident with technology when they're at home than they do at work. The knowledge of care technologies, assistive technologies, pendant alarms, sensors, monitoring, hydration, technologies that are rife across all kinds of different sectors within social care, people don't feel confident about at all. A very low awareness of artificial intelligence, either in terms of what that looks like and how it's used, or equally, what are the pitfalls and how we are critical of it. Not in a critique it, sorry, how we critique it. Don't really know. And equally, if the organisation you work in has a digital strategy, seldom are social workers, or in this case occupational therapists, but seldom are social workers actually involved in the shaping and narrative of that. So we perpetuate the cycle of lack of confidence because we don't include people in it, and it becomes a case of you don't know what you don't know. So I go back to the original question, is if who is leading the conversation around how social workers engage with technology, either in their own lives as a social worker logging into your case management system or whatever system you use. Equally, how confident do we feel about the technology that people we support use, and adding value to that conversation. So where do you start with that insurmountable evidence that I have put before you? Where do you start? What do you do? The answer is, it's tricky because there isn't a lot of information out there. And because social work is not a profession that is located in one place, it's not easy to point people in one direction, because there are lots of social workers who work in local authorities, as we know, the vast majority, but there are increasing numbers of social workers who work in the health service. There are increasing numbers of social workers who work in palliative care outside of the health service or social services, and there are increasing numbers of social workers who work in the voluntary sector. So there isn't one place for people to go. But what we do have is the Digital Skills Framework. And the Digital Skills Framework is designed for people who work in social care, and it's been tested and designed with people who work in social care to judge and rate your confidence around technology into 7 themes. And those 7 themes being how technology promotes person-centered care, because technology may not promote person-centered care unless we are proactive in that. Technical skills, how you communicate through technology, and that was found out through the pandemic as we scrambled to adapt to the situation that was forced upon us. How we manage data securely and in a person-centered way, and that sharing of data as well. How to be safe and secure online, the ethical use of data, how data is used ethically and unethically, and examples of that, and then how we can learn from that and how digital is connected to our well-being. That is a resource that is readily available for anyone, and I would be really interested for that to be tested out in people's supervision, for example. And similar to that, we have then linked a skills training database to that. So once you have completed, I'll go back a slide. So once you have looked at the skills framework and gone, okay, I'm confident here, but not here. I'm confident here, but not here. Well, what do you do then? You could, in theory, then go to the digital skills training base. The training is linked to the themes that are in this framework, and you can map where you feel most confident and where you don't feel confident, so that when it comes to any CPD requirements you have, any training requirements you have, any development you want to have as a social worker that's thinking around technology, contending with the issues that I've articulated thus far, you can go here and have a look. What else? Well, as you can imagine with government, things are always slower than you want them to be. Of great frustration to myself, but we are working towards a level 5 qualification in digital leadership for people who work in social care. That is likely to be launched by the end of the year. The reason it takes so long is that we create the framework for what the qualification should look like. Awarding organisations linked to Ofqual then say, yes, this is a formal qualification. Skills for Care then commission that out for the sector to then run with. So it takes some time, but up to this point, there has been no social care specific leadership qualification at a level 5, which is effectively a degree or there or thereabouts. But that will happen. And we also have free e-learning modules that are linked to the skills framework that I mentioned earlier on via Skills for Care, because we have commissioned them to do it. So we have e-learning modules, we have the digital leadership, and we have the skills framework and a training database. And I'm sure that your organisation may have areas to look at as well. I do not have all the answers to this, but these are things that are available for social workers to think about, contend with, and ruminate on. So who is leading the conversation? I think we should be, but I'm not sure that we are in the extent that I would like us to be. Is it supplier-led? Is it the suppliers of technology who are leading the conversation? Is it the commissioners? Is it government? Is it the people themselves and in conjunction with social workers? I don't know. And it will vary depending on your situations and anyone else's, because nothing is black and white. So questions for you. What could a digital skills offer to support you look like? What resources do you really need that you haven't got? What sort of topics are you begging out for support in that you just do not know where to go? And if this pricks any of your interest and you are remotely interested in anything that I've talked about and you want to talk more, I would be delighted to talk to you. I sit on steering groups and I run a community of practice, and I'm desperate and really keen to have more social workers in that space, because I think as social workers, we provide a unique perspective on all of these topics that I've highlighted. So my timer, I've got 1 minute, 20 seconds left. So these are my contact details. I'll give these to Denise to share, as well as the slides for you to look at your leisure. So over to you. We've got time for questions. These are some questions I've got for you, but what conversations do you want to have as a result of this topic that I've raised?
That's brilliant, Tommy. You've covered so much there. I can't believe you've managed to get all that in 31 minutes. But yeah, there's so much information to digest. In terms of the actual presentation, just to reiterate for those who joined a little bit late, we will share it, as Tommy said. But I'm just going through the chat, and we have had a comment from Ben, who was particularly interested in terms of the impact on relational social work. I don't know, Ben, did you want to say a little bit more about that? Not to put you on the spot.
I suppose it sort of reflects a lot of what you've been saying, Tommy, really. It's how it sort of weaves in and out of everything that we do within social work practice. And so I'm sort of using relational practice as a bit of a kind of a catch-all for power, for person-centered working, for, how do we understand the ecosystem and things. And all of those things can be quite different when you sort of overlay a digital lens on those things. So it can be quite helpful just in terms of sort of using digital as a way of kind of revisiting some of those kind of core social work principles, but equally digital changes those. I've been involved in a project looking at digital within children's social care, and sort of some of the ways in which obviously children view and use digital is very different from adults, and it's been helpful just to kind of think through what are those changes really. What does it do in terms of our relationships? What does it mean in terms of presence? I think that's really interesting. There's this sort of notion, isn't there, that digital is less valuable or has a sort of less good than face-to-face interactions, but you know, sort of, I think, is something about how do we change the way that we think about stuff? How do we put value in a different way? So it's just a sort of, you know, kind of trying to link it to social work practice in that way. That was, so it was more a kind of a thought than a question, but people may have different views.
I think the relational framing is really helpful, because I have had social workers say, I don't think technology is part of this and we should be person-centered, you know, and I think your framing around relational is a really helpful thing to think about. So that's a really good point I'll take away. Thank you.
Thanks, Ben. And just a reflection on that, we also know that depending on who we're working with, for some individuals, it's so much more beneficial to have an online discussion than an in-person discussion for a variety of different reasons. And I think we learned so much of that, didn't we, during COVID, that people actually kind of welcomed it with open arms, where previously it hadn't even been an option for them. I've noticed we've got a question here from Jane as well, in terms of potentially could AI be used in the future for mental capacity assessments and therefore digitalise dolls?
I think that's a, in short, yes. The problem we have, and the reason I say this because I've looked into it, Jane, is the problem we have with artificial intelligence is I'm not anti artificial intelligence, by the way. However, and this is where I think the role of social work is so important, is that artificial intelligence cannot contextualize, because it uses binary data that it's given to help the solution. So when you're coming to mental capacity, which we will know will fluctuate and is nuanced and is linked to so many different things of all those years of mental capacity since I've done, if AI can't contextualize, and yet we then rely on artificial intelligence as part of that process for establishing best interests and decisions, then is that not a huge risk? Anyway, I see your hand up, Jane.
Yes, yeah, I would agree. I guess we did a bit of work in 4 local authorities earlier this year and looked at best interest assessment, the Form 3s from the best interest assessor, and in the majority of assessments we looked at, the authorization was for 12 months, and where you had an older person with dementia who was in residential care, that was almost like 100% of that went straight to deprivation of liberty. I suppose to offer an alternative part of the discussion to yourself, Tommy, is one thing about the quality of the data that AI has on which to start making those decisions and generating its intelligence, if you like. Absolutely. And here I'm thinking about the Outcomes of Mental Health Act assessments.
Absolutely.
In which, if AI is fed the data that a young African Caribbean man is 4 times more likely to be detained than a white man, how can we ensure that, I suppose it's a bit of a philosophical question, really, a bit academic, but how would we ensure that the data quality is good enough to go down the route of AI for decisions around Article 5 right to liberty type decisions? So I guess there could be a discussion around the kind of gradient of decision making that we would feel as social workers is palatable.
Mm-hmm. Great example. And I'm not opposed to artificial intelligence being used, but the point that I would say is that as social workers, we need to be digitally critical. Digital is here, but the onus is on us to say it's here. To what extent do we use it? How do we use it? It's going to be used and is being used, but we have to be critical of it, and not in a it's terrible, never going to use it, shut the door, but holding it to account is what I mean. Angie.
Right. I've got a couple of questions. The first one, I am going to be a bit digitally critical, if that's all right. I'm just wondering, for me, technology, digitalisation is increasing at a rapid rate. However, how do we continue to support those people that do not have, particularly older people, any access to, thinking of my mum, she doesn't have the internet, she doesn't even have a smartphone. She's got a basic landline that when our local area moved to this digital voice thing, it completely screwed her landline up. So we had to get them out to do something to the phone because it was an automatic, this is going to happen. So she was without a landline for several days. And how do we continue to support those people that won't use technology? And I'm not just thinking of older people, but coming from a mental health background, people that have issues with paranoia, for example, so won't have things in the house. It almost feels like we're kind of having to fight for those people to maintain what they've got at the minute against digitalisation. And then I think my other question was in terms of how do we future-proof for increasing expectations? And I'm just thinking, I've been in many care homes where we're seeing an increasingly younger population coming into care homes, but those care homes aren't equipped. There's no internet access. I'm just thinking of a chap that one of my students went into a care home. The agreement that he chose his care home was they offered him internet access, would help him with his laptop so he could keep in touch with family. When he got there, they put him in a room that had no internet access and refused to get it done because of cost. They wouldn't charge his laptop, and eventually, after many complaints, lost his charging cable. So that completely isolated that chap. How do we consider these things in terms of funding? And I don't know, I've rambled on a bit there.
Well, I think that's a really great example because it's on one level quite innocuous, but on another level, it's absolutely fundamental to that person's experience of care. So I think that's a useful one that I may steal with permission, Angie, if that's all right. That was a really good one. The first point around, I haven't actually mentioned it in that whistle stop tour that Denise, you alluded to, is the digital exclusion aspect. You're fearful of the state, you're fearful of surveillance, you're fearful of technology being used to monitor you. You're fearful of this thing because you've no idea, you've never been in a culture that's used to it, and it's happening at a rapid rate. So again, all it says to me is it just further proves in my mind that social workers who then influence commissioning models or how things are purchased to then say, yes, but what about people who can't? Because I'm not saying we should be all technological wizards, chief information officers who can do all kinds of things. But what we should be doing, and I hesitate to say should because we are a broad profession, but we need to be aware of the landscape to be able to say, I don't have all the answers, but what I do see is this, and I want to hold decision makers to account because we are empowered practitioners. So again, and I do think the future is, I do hope that the regulator would take heed of that, because the world is moving at a rapid rate, but regulations will struggle to keep up unless it rethinks how it structures how we are trained. Because what I would observe is that I'll come to you in a minute, Lynthia. I would observe is that actually lots of people who work in regulated CQC care provider settings are quite advanced around this, because they don't have a framework to be held accountable to at the moment. There's no National Care Service as yet, and even then I don't think it'll happen for a while. But anyway, so the people are learning organically on the fly, whereas we still have a set of adhered guidance to follow, which is absolutely right and proper, and that's what's unique to social work. But wouldn't it be interesting if that guidance lent more towards what we are highlighting as a group? Anyway, I'll stop talking.
Yep, thank you for that.
Lynthia, did you want to come in? And then just to say as well, if we could, Karina after Lynthia, I don't know if you want to come back to the point that you were raising in the chat. Over to you, Lynthia.
Right, it's just a really quick point. Right, this session has opened my eyes to just how little I know. I saw it online, advertised, and thought, oh, I'll go along to that, because we're doing the 3 conversations model, a little small group of us, and we're looking at buying bits of technology for people to help. But it's so much bigger. I volunteered to go along. Sefton has a group looking at technology. So I volunteered to go along to that. I haven't been yet, but thinking it was going to be about how can we use Alexa to support with medication prompts and that sort of thing. So I just want to say you've really spiked my interest, and I will be going along to this group in Sefton. Thanks.
That's great. Thanks, Lynthia. And I think it's such a broad spectrum, isn't it? Because you're right, it is all the telecare stuff, it's the use of Alexa, but then it can potentially, the impact it can have. I've popped an article in there around how some local councils are already using AI, and Tommy described Copilot, etc., to kind of cut down on some of the time spent. Maybe it's drafting minutes, things like that. There's different uses that people are doing. I think Ben's mentioned that some are using it at the front door in terms of kind of screening, as ways of screening. But again, the word experiment used in there, and I think given what we know in terms of how those algorithms, how AI self-learns, and the biases that might then inadvertently be built in, we know that potentially there are concerns with some of that when you actually start to get into the assessment area, I think, and the use. But Karina, you'd mentioned something there about the psychosocial model. Did you want to say anything on that?
Yeah, so I guess it's just the recognition. We've had a big system being brought in called Epic, and alongside Epic, it's got this kind of new functionality. Everyone's kind of nodding. It's like an app called My Chart, and when it released, I think there was a little bit of a lack of recognition just how much of the information would transfer over to My Chart, and then the safety around that, and you kind of the ethical issues. And it was things like if you had kind of tagged one of the social determinants as safeguarding concerns, that would go straight through to My Chart, which anybody could kind of access. So it was then like once it kind of was released, there was a lot of work that had to be done to think actually some of this needs to be restricted. And even though we have much more recognition around kind of the social disciplines and the recording, there's still not that private space. It's still being held on a medical record. It's still visible to all disciplines, and sometimes it's not appropriate. So still lots of work to be done around the ethical issues of these kind of digital systems. But there's lots of capacity and potential as well. Lots of information sharing, being able to reach people at a quicker time. So it's just being able to find that balance between where technology can really assist us, and then making sure that we're still ensuring that it's ethical in its application.
That's great. Thanks, Karina. And just to come in on that, not that I have a bias towards any particular system, but having been a user of My Chart, being at the other end of it, I have to say the power it gives you as a patient. and knowing others who don't have access to a system like that, it's really powerful to actually be able to access your own kind of diagnostic information, and not that parent sits with a GP or a consultant who may or may not be willing to print it out and send it to you. It can be quite powerful. But absolutely hearing what you're saying around, you'd imagine that work would have been done before it went live, because I was involved with the health and social care record in my last organisation, and that was the hurdle that we just never quite could get over, of what level of information would be visible to different professions and different organisations within that. So it's interesting to hear that some of that work seems to be happening there retrospectively after it's gone live. Jane, I just saw your hand pop up and then go back down. Did you want to come in?
Yes, I was just going to be a tiny bit cynical, which isn't really like me, but I was just thinking what you were saying, Karina, and about in my local area, we have Eclipse West, Eclipse North. We have an old historical system, Care First. We have a big hospital in the area that has Rio, and we have the trust that uses System 1. And what would be really nice if they did speak to each other at some point, because there are ethical considerations, I think, when someone's records are all in one place, but they're physically in another, and that's where the assessment takes place. So that would be a great improvement. If, Tommy, you could just fix that, that would be great. Thanks.
Yeah. Yes. Well, you highlight that the dynamic that we have to play with is that the vehicle for a lot of this change to occur are IT suppliers who create the systems in the first place, right? So there are profit margins to be had. You can't shy away from that. And I don't necessarily say profit is a dirty word either, because I don't think it is, but there's not a lot of money in technology and social care. You look at the budgets of local authorities or care providers, it's a race to the bottom. And as customers and as people who draw on care and support, we haven't been asking for this for a long time. So it's new, and the role of government to shape standards is an interesting discussion, and we've started to go into that world a little bit, but it's hard, because if you're a council, you are accountable to your ballot box ultimately and your constituents, and you can do what you think you need to do. And then on the CQC, and equally, if you're a care provider, you are an independent business. So there are additional dynamics that are below the surface here around change and how things get fixed that take a long time, but ultimately it's people who we support who potentially suffer as a result.
Thanks, Tommy. We've got something in here from Danielle. Danielle, I don't know if you want to speak to the comment that you've put in the chat around how is this different from reading notes in the My Chart app?
Hi there, everyone. Well, it just occurred to me that it sounds as if the My Chart is a universal way of capturing data. And that data becomes accessible to all care providers, which is really important. And then, the issue of confidentiality is no longer an issue because it's a generalized system, and I get that. But I just wonder, how different is it from, the human failure of capturing or reading that information? Like, does drift occur in any particular way, I suppose? What has anybody commented on the human error in not getting that information in spite of it being accessible to all parties?
Yes. Yeah, so if I take a more sobering example, if you look at any serious case review where a child has died, the serious case review theme will quite often say information should have been shared better between agencies. So we know that we know that information is now available, but it's the connectedness of that information that at the root of it being that person's experience, however vulnerable they may be. We know that information is there, yet it is not connected in a holistic way, honouring of the person that we are trying to support. So it's a failure of social workers not being empowered, I would say, and not leading the conversation because we didn't know what we didn't know. And so it was down to other people to do. And the fact that things move so rapidly, I think, is part of it. There's lots of other elements to it that we could probably talk all day on, Danielle, to be honest. But I think you're right. Yeah.
I think just to jump in there, it's exactly the same in adult serious reviews as well. It's always information sharing that's one that comes out as a theme.
Thanks. We've just got time for one last comment or question from Karina. Want to come in?
I was just going to say, just to add, really interestingly, Epic in itself is kind of a barrier because it's got different permissions. So I've had to fight really hard as a manager to be able to access areas that consultants can only access, even just to do safeguarding reviews. So, it's just even in the way in which these systems are built, particularly within healthcare, social work is kind of seen as this can only have so many permissions, not allowed to do all these types of orders, and has significantly kind of impeded our ability to undertake CQC reviews and things like that. So yeah, lots of, I guess, consideration to be had around how these systems actually work and what the permissions are like and their interfaces, and making them appropriately accessible.
Yeah, absolutely. And what a note to finish on. if we could fix that one, how much we would progress, because having systems that speak to each other, that you actually have the information you need, that also then protects the rights of the individual. Yeah, that's $1 million issue to be resolved, really, isn't it? Yeah, I just want to say a huge thank you to Tommy for the presentation. It's probably raised more questions and provided us all with a lot of food for thought, which we're going to go off and unpick. So potentially we may have a part 2 to this session, I think, Tommy willing, maybe to pick up on. Yeah, I think we've started something with this, so I think it'd be great to continue. And a huge thank you to you as well for giving up your lunchtime to come along and join us today. So we are hoping to upload this to our YouTube site, so we will get that sorted out as soon as possible, and we'll share the presentation. So thanks again. And if I could just point you towards the chat, there's a link there for our evaluation sheet. If you could just fill it, it'll take you literally 3 minutes. Gives us an idea around what worked well today, what didn't, and also if there's any future sessions you'd like us to put on, we'll take that into account when we're planning our next few sessions. So great to see everybody today, and thank you. Take care.
Thank you.
Bye bye.